A star-filled night sky shimmered above the Earth. The Earth seemed lost in the depths of infinite space, but there was the complex world of billions of people living on it. It was a night that would be one of the turning points for humanity. The lights of a laboratory were the only source of light in the darkness of the night. Dr. Emily Collins, along with a team of scientists, was hard at work. In the rooms of the CDC, Centers for Disease Control and Prevention, a laboratory for the study of epidemics, a group of researchers were tracking an unknown virus. A few weeks earlier, a worldwide epidemic had begun. People were getting sick and dying rapidly. The source of the virus was unclear, and scientists were scrambling to find the origins of this fast-spreading threat. The coronavirus, or coronavirus, Latin orthocoronavirinae, are viruses that cause disease in birds and mammals and form one of two subfamilies of the family Coronaviridae. In humans, the virus is usually not serious, causing a significant proportion of cases of the common cold, but some rare coronavirus variants, including MERS-CoV, SARS-CoV, and COVID-19, 2019 nCoV, can cause respiratory infections with the risk of death. Coronaviruses were discovered in the 1960s. Among the first viruses discovered were the infectious bronchitis virus in chickens and two strains of viruses taken from the nasal cavities of human patients with cold symptoms and named human coronavirus 229E and OC43. Subsequently, many new coronavirus strains have been discovered, including the SARS coronavirus discovered in 2003, HCOVA NL63 identified in 2004, HKU1 diagnosed in 2005, MERS-CoV recognized in 2012, and COVID-19 originating from Wuhan. Most of these viruses cause serious respiratory infections. Coronaviruses are large, pleomorphic, spherical particles with protrusions on the surface. Virus particles are approximately 120 nanometer in diameter. The viral envelope is visualized as an electron-rich shell on electron micrographs. The viral envelope of coronaviruses consists of a double-layered lipid layer with membrane, envelope, and specie S proteins. Certain groups of coronaviruses, particularly the beta coronavirus, a subgroup, contain hemagglutinin esterase surface proteins, which are similar to spike proteins but shorter. Inside the viral envelope is the nucleocapsid. The nucleocapsid consists of many nucleocapsid proteins bound to positively oriented, single-stranded RNA coronaviruses are thought to be responsible for a significant proportion of cold cases in adults and children. This group of viruses causes symptoms such as fever and enlarged tonsils, but most commonly causes colds in winter and early spring. In addition, coronaviruses can cause pneumonia and bronchitis, viral or secondary bacterial. Stay safe.